I may be dead, but I'm going to haunt you.
A lot of passion around this topic. Arkansas veterans are battling with the fear that they may have been misdiagnosed. It's an update to a story we brought you last month about an impaired pathologist at the Veterans Hospital of Fayetteville. KRK 4's Peyton Yeager has been following this story, and she has the very latest for us.
We've been following this investigation since June 18th. That's when it first became public about this pathologist. And the director today tells me 33,000 of the 33,000 cases have been reviewed so far. That's about 9% of the workload. And this federal investigation is expected to last about 6 months. But one of the cases that hasn't been reviewed yet involves a woman whose mother died from cancer in December of 2017. That mother was a patient here at the VA. And that daughter tells me that she wakes up every day wondering if her mother could have been saved.
That I know that I owe you answers, and I'm going to get you those answers.
A room packed with worry, confusion, and anger.
Somebody owes my family some explanation. Happened to my mother.
Crystal George is in the audience standing up for one of the 20,000 potentially misdiagnosed VA patients. Her mother died in December from lung cancer. George worries her mom's disease could have been caught earlier if it wasn't for the impaired pathologist.
When they found her cancer, she was stage 4 terminal, and it's a slow-growing cancer. So how does this slow-growing cancer develop over a few months?
The interim director of the Veterans Healthcare System of the Ozarks, Kelvin Parks, says a position has been added so this incident doesn't happen again.
We've inserted a quality officer that when those reviews go out, they'll come back to the quality officer who is non-biased and not a member of that laboratory department. They work for actually quality department.
The hospital confirmed Monday the impaired pathologist went to a treatment facility after his first offense in 2016. He was allowed to continue practice once he completed the program before he was caught again. But the hospital hopes this second chance attempt doesn't come back to haunt them.
I'm deeply sorry that this has happened. I take full responsibility for this look back.
George says these changes can't bring back her mom, and she still questions, was her mother's death preventable?
Who I felt could have got better care. You know, I don't feel like our mother's care was to the best standards that it should have been. That's the bottom line.
Now, right after the meeting, Georgia and her family met with the hospital to fill out a form that could possibly get them compensation from the VA for death or disability. And the hospital is going to hold a town hall meeting every month until the federal investigation is over. We're live in Fayetteville. Peyton Yeager, we're going to send it back to you.
Peyton, real quick, for this physician having, I guess, worked at this particular location for the past 10 years, there's going to be a lot of cases for federal agents to go through. Where does the investigation go from this point?
Well, like we said, we updated about a couple weeks ago 900 cases, and now we have 3,000 cases. And the VA tells us it's going to take 6 months, but we are not sure how fast they're going to go through. But we're up to 3,000 cases right now. That's 33,000 cases, 20,000 patients. It's a lot for them to go through right now. We're going to keep you updated.
All right, Peyton, thanks very much.